Limiting liability with law enforcement administering naloxone, i.e. Narcan. There are several ways that law enforcement agencies are able to limit liability when administering Narcan, the potential life-saving drug. Agencies have to create policy, procedure, and training material to make sure that their officers are capable of knowing when to use the drug to prevent civil liability. What is naloxone? Naloxone blocks or reverses the effects of opiate medication, including extreme drowsiness, slowed breathing, or loss of consciousness. An opiate is sometimes called a narcotic. Naloxone is used to treat narcotic overdose in an emergency situation. This medicine should not be used in place of emergency medical care for an overdose. Naloxone is also used to help diagnose whether a person has used an overdose of an opiate. What is an opiate? Opiate drugs work by binding to opiate receptors in the brain, spinal cord, and other areas of the body. They reduce the sending of pain messages to the brain and reduce feelings of pain. Opiates are used to treat moderate to severe pain that may not respond well to other pain medications. Examples of some opiates are codeine, fentanyl, hydrocodone, hydromorphone, and others listed. Policy and procedure. Policy and procedure typically establishes rules and regulations officers have to follow while conducting law enforcement work. Usually, if an officer abides by his state laws, city regulations, and department policy and procedures, they are covered and protected from civil liability. Agencies have to establish a policy and procedure on when to deploy and not deploy Narcan. Although deploying Narcan on someone not experiencing an opiate overdose is relatively harmless, administering too much Narcan on an individual that may cause the person to have withdrawals from the opiates. But with the proper care, that withdrawal can be cared for. Training officers to use Narcan on the job. Proper training can help avoid facing civil lawsuit when using Narcan on an individual in the field. Typically, medical facilities and agencies in local areas can provide adequate training on the administration of the drug. Often, Narcan is deployed by a needle, but some forms of Narcan are available by nasal spray. These are my references, which I used to create this Prezi. Have a great day.